So testing was the big question that we were talking about until last week. And now persistently that we have been asking is, do we have enough kits if we talk about both PCR and antibody kits? So what is the situation on ground if you can share with us?
Yeah. Antibody test kits are not available in the country till today. It was to come some 1 week back. 4 times it has been postponed. There is a likelihood the kit might come by 25th of April or later, not before that. So antibody testing is only negotiated as a, talked about as a good test or not a good test, but it has still not arrived, and no one has any experience of using it in India. In case of PCR test, we are now doing in private laboratories for the last 15 days. And the first week it was daily supplies, small quantities. Now there are weekly supplies in bigger quantities. And there is a likelihood from next week onwards, we can order as much as we want because adequate number of vendors have arrived. And there appears to be not a big challenge.
Right. So if we speak on the basis of these antibody kits and the urgent need of rapid testing in India, what is the accuracy level of these tests?
See, let me tell you what antibody test can do, PCR cannot do. What PCR can do, antibody test cannot do, though both are for COVID. I'll elaborate on it. The PCR test tells whether virus is in the body or not. Antibody test tells whether the individual had an exposure infection or not.
Right.
Antibody will not be able to confirm currently virus is there or not. And virus presence only will tell there is virus and you can treat it or you can quarantine it or you can take care of it. So these are two different things. They are not the same thing. So currently we do only PCR tests, and PCR tests are today available in the market. And 4,500 rupees is the rate. The rate is pretty high for middle class, only rich can avail. So there are inquiries and we are servicing them. And the poor is not consuming. The rich is consuming. So if you ask me, rich consume, not poor. Panicked consume, not the ones with symptoms. Because the guy who has symptoms may not have money. So
you also tweeted about this, where you mentioned that the whole concept of free testing has been misinterpreted because of the rich trying to take it, and if we go by the Supreme Court's word, then it meant for the economically weaker section, if I'm right.
Exactly. See, I will tell you why it all went to chaotic. In the testing community, let us say after 6 months, we find out the income groups. 90% must be rich and 10% must be poor. So if the government has to pay for all, government is spending money for the rich, not for the poor. So I think government was shocked when Supreme Court said do it free for all.
Right.
I think they went back and they also wanted us to say what are all the pains, and we set the pains, and then Supreme Court has tweaked the verdict, and I think now it is in right place. If somebody is panicked, let them pay. If somebody is rich, let them pay. And if somebody truly needs a solution, let them go to the ICMR hospital, and they have a free service for the treatment of COVID, the diagnosis of COVID also they will cover. I think now it is in place. And only challenge is adequate testing happening? This is the next question.
Right.
Adequate testing is not happening, and people have understood it is a 15 days of Tufan, and diagnosis doesn't offer any advantage of outcome. Diagnosis is not helping the patient per se. It helps the people around them and get quarantined from the challenge. So people haven't taken diagnostic test. You know which diagnostic test is more used is the diagnostic test which changes the course of the treatment or course of the outcome.
Right.
And if it is not influenced, I think it is fair to understand the man is going to accept as he has got or he has not got. If he has got, he will have a relief much later. If it is not COVID, he will get relieved earlier. I think people are going by that. Otherwise, looking at the Bombay's load, one should expect that the number of tests will be too high. But having said that, Bombay has got as of today testing around roughly around 7,000-8,000. You can call it as big number or small number depending upon how you wish to see. But certainly today tests are done 10 times more than what it was done 2 weeks back.
Right. But so my question is, since you're mentioning that there is no adequate testing, is pool testing a reply to this, that probably, getting this whole concept of, and which I think has been a very delayed decision, if you agree to it, the whole concept of getting pooled samples after, I think, more than 1.5 months, this probably could have taken when the whole debate of no kits had started. Doing it now, when we are at a juncture of lockdown in the country. Your opinion on that?
See, the pooling is very useful when the incidence is very low and the reagent cost is very high.
Right.
So let us say the incidence is 1 in 10,000. It is not making sense to keep doing all the 10,000 using a costly reagent of roughly around $25.
Right.
It's not making sense. But if it is 1 in 1,000, it is still making sense. If it is 1 in 100, still makes sense. But today, what we are testing is roughly around 7 or 8 in 100. Now,
Right.
when 7 or 8 in 100, when you pool, there is a likelihood all pooled will be also positive, and then you have to identify out of them who are negative.
Right.
So whenever it becomes higher frequency or incidence, the pool size goes down. You can't make big pool because again you have to retest, and every retesting will take longer time to report, and every step is going to take 8 more hours. So pooling in case of this pandemic, especially when patients around are highly infected, will not work anything more than 1:4. That is what ICMR has recommended, 1:5. And we also have internally studied it. It is 1:4. Anything more than 1:4 delays it, and there is no economy. So pooling will increase the capacity by 40% of the laboratory because you are not testing all, and some of the negative you are not testing.
Right.
And it will also increase the turnaround time for 25% of the cases by another 8 hours. So there is a positive side in it. There is a negative side in it. And pooling will only reduce 30 to 40% cost in the raw material. But the raw material itself is only 30% cost of the total cost. So there is a likelihood you would get around 15% only reduction, not too much of reduction. Initially, we felt that dilution can be 1:16 and 1:32, but the kind of positivity around is reducing the opportunity of diluting. But having said that, a family of 4, if we test, either all 4 are positive or all 4 are negative. So there is a likelihood when you choose the pooling members, there will be a better saving. But if you ask me, nothing more than 20% of the cost will be down. And in some cases, the turnaround time can go up, but you can do more tests.
Right. So trying to catch in that view, you were saying that it's more on the economic side of it that it's going to benefit in cutting down the cost of the resources. So one last question I want to talk about, which is important that you've also spoken about previously, is that in this whole phase of lockdown, we are prominently focusing on COVID-19 patients. But what happens to the non-COVID healthcare? Where,
Yes.
how crucially are we lacking in there? You've shared numbers, of course, on your social media talking about the deaths that have occurred of non-COVID people. And is this, I mean, is this a scenario where now we have moved our focus completely on one particular, of course, it's a global pandemic. We are over focusing there and maybe letting down the rest, or is it just a mismanagement?
I think we have overreacted to COVID. Many people troll me in social media if I tell it is overreaction. And I am of that opinion. The complete close down of COVID, sorry, non-COVID. I have called it as Novid to simplify it in terms of calling it. The Novid testing is today zero. I received in March 13th when we were observing that Janta curfew the previous day, 80,000 specimen. Today we only have 80 specimen, which means we have completely closed down, not only in Thyrocare network, in all laboratories, it is closed down. And shockingly, all hospitals have some kind of positivity among the staff and caretakers. They had to completely quarantine and close it down. So what does that mean? That many patients were dying. The entire healthcare was in the country was focused only on their health. And in spite of that, there were so many dying. Now today, if you ignore it, it will double. It will double a day. Now, where are we focused? So people should not think this or that. People have to think this and that. Healthcare-wise, there is a calamity brewing. Many people have voiced out, but they didn't tell it correctly. People thought that they are opposing lockdown. They are opposing the ruling party's control over the movement of the people. Everyone is right. But if you don't care for non-COVID patients, you are going to come up with some other serious problems, which is very difficult then to manage. And I also want to tell COVID management is simpler because it doesn't need huge medical infrastructure. It needs only quarantining more, ventilators more. Non-COVID requires huge surgical interventions also. So I sincerely wish the government understands and allows the non-COVID also to be parallelly carried.
Right, sir. So one last question before we end this, that your word lockdown has been increased, of course, by another 19 days to be precise in the country. Do you think the whole credit goes to lockdown, with India, of course, making its efforts to control the pandemic in comparison to other countries, or do you think there are other such positive factors that are probably have involved in controlling this at a better level?
Yes, I very politely tweeted, still I had trolls. All believe that all credit should go to only the lockdown decision. I just cannot agree with that because I don't think if that was because of lockdown, you can't unlock it lifelong. So I believe that India was blessed with a low mean age in the country. I believe that we have a better immunity because of age and because of some of the BCG and malaria and all those things. All are supporting. And I still believe half of the benefit is from lockdown. Remaining half is from the other parameters. And just locking down, if it is a solution, we just cannot unlock it. This has to be kept in mind.